And now I get the pleasure of introducing our keynote speaker, and that is Senator Manka Dhingra. And I'm not going to say a lot about her. Everybody knows Manka, and she's probably is one of the few people up here who's actually is comfortable talking to a room this size. Most of us are not. But she's good at it, and she's going to give us our keynote presentation this morning, and we're privileged and honored, and thank you so much. So I'll turn the stage over to you. Okay.
Thank you. Good morning. And now, without tears, can I just say, I just want to thank Dr. Initzer, and I'm just so glad that the UW Teaching Hospital was not made from an old building that had lost its purpose and was constructed specifically as a place of healing. So I'm so glad as a state we were able to do that. Thank you. And thank you so much for the Crooks Family and Chad Legacy Project for inviting me here today for this incredible conference. I have attended this conference for years, and as I look around this room today and see the hundreds of people here, the work, the passion, and the expertise in this room, it is truly tremendous. You have truly built a legacy that you can be so very proud of for the people of Washington. Thank you. Good morning. My name is Manka Dhingra. I am the Deputy Majority Leader of the Washington State Senate. I'm the former chair of the Behavioral Health Subcommittee and the current chair of our Senate Law and Justice Committee. You know, before running for the legislature, I was actually a senior deputy prosecuting attorney with King County. And there I created the first in the nation therapeutic alternative unit at a prosecutor's office, where I ran our mental health court, I helped create our veterans court, and I also helped create a 40-hour crisis intervention training for law enforcement, and I trained law enforcement for 10 years before I stepped down to run for office. It is so important in a crisis situation, especially when law enforcement is called, that they are trained on how to slow down, how to assess a situation, and really make sure they're being deliberate about their next steps. And one of the things that I loved about teaching this, being a part of the 40-hour training, is that every week, after that 40-hour training ended, I would get a call from a police officer. This was an officer who had attended that class, and he would share a story with me. The one that has stayed with me for years is an officer who responded outside an elementary school because there was a man with a knife, and school was about to let out. He had just completed his CIT training. He responded to the scene, and his training kicked in. He did what we would expect a well-trained officer to do. He de-escalated the situation, he removed the knife from the hands of this man, and he took the man to the hospital. No one found out about this, no one covered this in the newspaper, because it ended the way it was supposed to end. These are the stories that we want to talk about. How do we respond to situations? How do we make sure people are getting the help they need when they need it? You know, there is something fundamentally wrong in a society where the largest mental health hospital is our prisons and our jail. We have to put the experiences, the needs of the people with behavioral health issues and their loved ones first in all that we do. All of us know someone living with behavioral health issues. There are neighbors, our friends, our family members, ourselves. We must approach this as a health issue, not a criminal justice problem. And this means focusing on treatment and early intervention, getting people the help they need when they need it. Our vision is that no matter where you live or what your financial situation is, you can easily access the treatment all the way from the top of your head down to your toes. This vision of access to health care that is affordable and available is what drives the work that I do and the policies that I work on. Over the last 8 years, people from around the state have come together to transform our behavioral health system. So many of you, all of you in this room have been part of that. We are building a comprehensive approach to behavioral health that includes a robust crisis response system that also builds the tools to intervene before people have a crisis, moving away from a reactive model of care by investing in intervention and diversion programs. This means we have to make progress in 3 areas: crisis response, crisis prevention, and growing the behavioral health workforce. And we have made progress in all these areas in recent years. Though I do have to take a moment and acknowledge that while we do have a lot to be proud of, this year we had a very challenging state budget that has been exacerbated by what is happening at the federal level. There are going to be so many more challenges for people to access the services they need. But I do want to make sure that we're continuing to work on a system that is in line with our vision for an affordable, appropriate treatment on demand. But I do want to acknowledge that it is going to be an extremely rough few years. We are, however, building capacity for services across the behavioral health care continuum: a place to call, someone to come, a safe place to be. You know, in order to have a place to call, we established and improved a 988 suicide and crisis lifeline. The 988 system is the place to call. Clinicians are there to provide support if you or someone you know is experiencing thoughts of suicide or self-harm, dealing with emotional stress, depression, anxiety. 988 can help support 24/7, 365 days a year. There should be no one in this room who does not know 988. Tragically, 1 in 4 deadly police shootings are a result of officers responding to people in a behavioral health crisis. Having a behavioral health crisis is not illegal. It is a cry for help. And it deserves an immediate response from appropriate medical services with coordination from law enforcement only when safety is an issue. I'm so proud that in Washington, we have been leading the 988 effort. In February of this year, clinicians in Washington answered 94% of 988 calls. In some states, that rate was as low as 57%. And I really do want to give a shout out to everyone who is working on that 988 system to get us to a rate of 94% calls that are answered in state. The overflow state go to other states that have the ability to respond to a call. But 94% is something we should all be very, very proud of. The key to a 988 system is the 40-cent telecom tax we set up per line. Thank you, all of you, for paying this on your cell phone. We need to ensure the system has robust funding because people cost money. Helping people who need a lot of services costs even more. And having a dedicated funding source is what is going to enable us to continue with these projects and continue with these services. Since 988's launch, we've also started a dedicated Veterans Crisis Line, an LGBTQ plus line, a youth line where teens can also text to get help, and of course, the first in the nation, Native and Strong line. I will tell you, every single one of these dedicated lines is under attack from our federal government right now. And we do know that having these dedicated lines and culturally competent care are so helpful in making sure we're building trust within our communities. We are, each and every one of us, going to have to fight to make sure that these lines that are culturally competent continue to exist in the state of Washington. In 2021, we passed a bill that created the CRIS Committee, the Crisis Response Improvement Strategy. You know, a good bill is like a good novel. It reads well, but unless you put money behind it or have an implementation plan, it doesn't quite work. And that is what the purpose of the CRIS Committee was. We wanted to make sure we were going to be as inclusive as possible, so every subcommittee tackled a different aspect of this bill to make sure we have services to everyone regardless of where you live in our state. We expanded the services provided through 988. We formed expanded the 12 mobile crisis response teams and enhanced coordination between 911 and 988. And that coordination works so well because so many people call 911 not understanding that what they actually need is 988. And having our 911 call centers be able to do a warm handoff to 988 is incredible. And so that partnership has actually resulted in ensuring that people get the care they need when they need it and get the response that is appropriate for their level of care. We actually created the Rapid Response Crisis Teams. That is the first line of defense for people experiencing a significant behavioral health emergency that requires an urgent in-person response. I want to say there is funding available to get certified to be a rapid response crisis team. So if anyone's interested, please know there is actually funding available to do this work. And that is because of the dedicated tax on the line. We are also developing regionalized coordination behavioral health crisis response plans across the state because we know we cannot have a cookie cutter model. What system works in King County is not what works in Kitsap County, and is not what works in Walla Walla. So really making sure that our behavioral health organizations are responsible for coordinating a crisis behavioral health plan in each region. So we can make sure that people, again, are getting the care they need, when they need it, and in a way that makes sense for where they come from. And then we establish a system for certified crisis relief centers. This is a new facility type that does not exist in the state of Washington. Right now, they have to have medical clearance, they have a lot of rules they have to go through in order to drop someone else in crisis. And so instead of dealing with that, many of our first responders find it easy to drop someone off at the emergency room or the jail. So these crisis relief centers are an alternative, a no wrong door framework, which means that law enforcement first responders show up, they open the door, they accept the person, they say thank you, and they shut the door. And these are centers where people can get short-term care and make connections for longer-term services so that they can get stable without needing to go into an ER. These centers open 24 hours a day, 7 days a week, offering immediate mental health and substance use care to adults for up to 24 hours. And because of the advocacy of children's, we now have relief centers for our youth as well. Last year, and so I do want to tell you we do have a couple of these facilities running. There are many that are going to be popping up all over the state. There's still uncertainty on this funding model. There's uncertainty on what's going to happen with Medicaid reimbursement rates. So I also know that there are many facilities that are pausing, starting to figure out what is happening at the federal level. And so if anyone is thinking about a facility and is pausing, please, let's have a conversation. I know there are many already who are hesitating or slowing down their work, but we have to make sure we get these facilities up and running. We have to make sure that when we talk about integration, we mean actual integration. You know, Washington talked about integration and about parity between physical and mental health. And I have to say that in practice, that is not what the experience of people are. And we have to make sure that we are changing it. And this is where we have to make sure we have the workforce we need to get this work done. Because we can open facilities, we can change laws, but if we don't have the people to do the work, it is, again, a good novel we can all read and say, what if? Wouldn't it be lovely if we had people who could do the work that they do? And so we are trying to make sure that we are expanding who is part of a mental health team. I was really proud to work on a bill that provided occupational therapy services for people in the behavioral health field. I gotta say, this was a bill, when I started talking about it, I introduced the bill by saying, I can't believe I have to do this bill, because I thought we had integration. Like, why isn't this already a thing? But we actually had to pass a law to make sure occupational therapists are part of a mental health team. We know they teach basic activities of daily living, household skills, and methods of managing acute symptoms, which can make the difference between continuing to stay in your home or being sent to the emergency room. We have to make sure that when people want to access substance use disorder treatment, that the barriers are removed, the red tape is removed. Representative Davis is just such a huge champion and such a great colleague to work with in this arena. And the work that we've done in substance use disorder to really ensure that we are trying to get people into treatment effortlessly. We noticed that the average length of stay was 11 days. I remember the days back in the day when you could send someone for treatment for 29 days. And unfortunately, with integration, that's kind of gone with the concept of medical necessity. So a lot of work being done around that, really making sure that people can at least go into treatment for 14 days at a minimum, making sure that that extension for more treatment is as effortless as possible. But these are the barriers we have to break down in our system if we want to be patient-centered. And I was really proud that we had created a pilot program called the Post-Inpatient Housing Program for Young Adults, also called the Bridge Program. And this was to improve support for adults up to 24 years of age who are exiting inpatient behavioral health treatment. Children, people need transition help. And so when we take a look at how are we improving our crisis system, it is not simply responding to when people need something. It is making sure that they're able to go to the next level and making sure that there are warm handoffs for people. And when we are talking about people who are in need, it is critical at that point in time that we are looking at them and saying, how would we want a loved one to be treated? And using that lens as a way of delivering services. And that is not just for the people who are doing that level of care. It is the lens we need to be using when we're developing programs, when we're developing laws, when we are dealing with funding issues. Because it is the funding that ensures that the treatment is developed in the manner in which it is intended. And I just want to say once again that the budget shortfalls we faced this year meant we had to make cuts in areas where we typically lead. And this does include behavioral health services. But I do want to say that we also made sure that these budget cuts were they were all harmful, but were as harmless as possible. We still invested in capital improvements for mental and physical health. We're finishing up the new building at Western State Hospital. We also set aside money to expand capacity for behavioral health in community settings. And we're really making sure that we are funding sites as Compass Health in Everett, the Center for Alcohol and Drug Treatment in Wenatchee, the Jamestown Skull and Behavioral Health Centers in Sequim, the Nisqually Tribe Healing Village in Olympia, and so many more. Really partnering with our tribal leaders to again make sure that we are providing treatment no matter where you live in the state of Washington. We also provided $32 million to establish a Lake Burien residential treatment facility to support youth with complex needs. We've done a lot of work to purchase and modernize the Olympic Heritage Behavioral Health Facility in Tukwila. We have new 54-bed facilities that will be opening in Vancouver. And I can talk about all these investments we're making at the state legislature. And I can also tell you, and you can tell me, that you know these investments aren't enough. And so when we work on policies, when we work on legislature, the reason why we can be successful is because of each and every one of you. You are the ones who know what the biggest problems are. You guys are also the ones who know what the solutions are. And so when we are effective in the work that we do as a state, is because you come to us and say, this is a problem I see, this is the solution that I want. And that is how we make sure we improve the quality of life of each and every one of us. I am so grateful for people like each and every one of you who are working so tirelessly to ensure that every single Washingtonian can get the care that they need. For so long, Washington has been at the bottom when it comes to accessing mental health services. And I'm just always so proud when I see our state moving up through that list. We have a long way to go to be number one, but I know we can do that. And I also want to say that democracy is not a spectator sport. It is a team effort. This work gets done because so many of you show up in Olympia to have your voices heard. We have thousands of bills that are filed every single year, and a few hundred get passed. And everyone wants to know, how do you make sure your bill gets passed? It's not because they're bad ideas. There are lots of great ideas. It's what great ideas boil to the top. And the way you get that to happen is because each and every one of you calls you elected, shows up in Olympia, and tells people that this is a great idea. So whichever bills get the most attention are the ones that pass. And here's the secret. You know how they get attention? Because each and every one of you is paying attention. Because if you pay attention, you can call your elected official and let them know to pay attention. You can let your community know to pay attention. And that is the secret of passing legislation. So I expect to see ideas from each and every one of you for next year, and I expect to see the vast majority of you in Olympia ensuring that we in Washington are really becoming the place to be to access affordable mental health services for the people who need them when they need them. So thank you once again for the work that you do, and I'm so grateful to be here with all of you once again. Thank you.
What a relief. I'm so glad she's there. And Lauren, it is a lot of work, and it was an incredibly difficult session. There you go. So we do have some time for some questions from the audience. We have mics on either end. And thank you again for being a champion for mental health initiatives. I'm going to go ahead and start with one question. What is the biggest barrier in getting mental health bills passed? What do you encounter as you try and get this through?
You know, thank you. Everyone will tell you that they want people to have access to mental health services. I would say one is absolutely funding, because good ideas, effective ideas, cost money. And so it really is about making sure we are talking about how do we fund the new program or expand funding? How do we do reimbursement rates? The second one is really making sure you take the time to work your bill all during the interim. So when you introduce it, it is good to go. Because I fundamentally believe that everyone working in the behavioral health field has great intentions, but everyone also has different ideas. And I can tell you that one of the toughest bills I worked on was a 988 bill. And I do a lot of work in criminal justice reform, let me tell you. And the reason why this was so hard, because when it was first introduced, the first hearing in the House did not go so well. Because again, people have a lot of great ideas on what they want to do. And I will say, I really felt like a bull in a china shop with that bill, because I really wanted to make sure we passed it. And so this was a bill before we had the hearing, I just told everyone, I said, we're going to pass this bill. Either you can be part of figuring out the solution, or you can sit down. That is not the way I normally work, but that is how we really made sure we got that bill done. And it is because every single person, every single stakeholder showed up with the intent of making 988 successful. Every single person. After that first House hearing, I can't even remember a scenario where someone was not solving problems or wasn't mission driven. It was an incredible bill to work on after we got past that initial hurdle. And I truly do believe the reason we have gotten an award for having the best 988 system is because everyone put aside their egos and was rowing in the same direction in ensuring that we're doing the best we can for our behavioral health community. And you know, when I mentioned workforce, I'm so sorry, I'm going to go off the question. I failed to mention our peers. That is one of the most untapped resource we have as a state. And I love the work that we've been doing in the legislature to really make sure that we're making our peers part of our workforce at every single step of the behavioral health continuum of care, because I think that is so critical for how we deliver care.
Thank you. And I think we have a question over here.
Yeah, can you hear me? Oh, hi. So thanks so much, Dr. Dhingra, for your presentation, and I think it's really nice to see that things are happening and initiatives are out there to address the needs of the people who are in this journey. I'm going to a little bit tweak the question towards a little bit of inpatient. I know this is more sort of out on the community, but I am an inpatient provider. I work with the traumatic brain injury patients, and what I see in my practice is that 1/3 of our patients do have substance use disorder or have co-occurring mental illness that we deal every day. So the biggest challenge we have when they're ready to be discharged, or when they're ready to maybe the best time to intervene on their issues, we have difficult time to either place them to places that if they need to go to SNF or other places, or refer them to the treatment that they would need after done with their treatment in inpatient. So I just wanted to know if there is any initiatives out there that we can tap into, because I think that's maybe we can do the biggest change, because people are now there. This is consequence of the health issues on top of their mental illness that goes on to also physical, mental, and other additional economical and issues that will come to surface. This is just a sort of conversation to think about them in a more holistic way. I was wondering if there's anything that is out there that's been being done. Thank you.
Oh my goodness. Again, the need is just so much there. And I know Rep. Davis has done a lot of work in recovery houses and really trying to find a place where we can have people who are exiting, especially inpatient, go. And that's what we were doing with the Bridge program for our adolescents. But this is where I encourage anyone who's interested in getting involved in this work to reach out to me, Department of Health, Healthcare Authority, and really talk about, is there a provider out there willing to provide that level of care? Because what we find over and over again is that we need providers who want to do the work. I'll tell you, 2020, when we ended that session, that's literally when COVID started, but that budget was my ideal behavioral health budget. We had provided so much money for services, for support, for housing, new programs. I was so excited, and then COVID hit. And what I found over the next 2 years, because we had these grants that were available, and I kept asking providers, are you guys going to use the grant? We have money for this, we have money for that. And a lot of what the providers said is that the people who work here are so exhausted, I cannot introduce another program for them. And so there is the reality of who is willing to do the work, who is able to do the work, and then talk about the funding that's needed to successfully do this work. So we have a lot of gaps and holes in our system in what we would envision wanting for people. And so you guys are the experts in the state. And so I would love to know, that is an actual hole in our services that you have identified. Is there anyone willing to do this work? And if you are, raise your hand. Let's talk about what it takes for us to get there. And let's just keep making a list of all of these services we wish we had and see how we can fulfill that wish list.
Thank you. Thank you. And we'll go to this question over here.
Thank you.
Hi. I am frustrated by the lack of understanding around the cost of not caring. So how do we convince change makers at the state that funding mental health will save the state money?
I have this conversation, and I sit on Ways and Means, and that's our budget committee. I really think every single person there is so sick and tired of me saying that. And to me, that is exactly what it is. When you invest in early intervention, you're going to save so much money on crisis care, because crisis care is so expensive. And so, unfortunately, we don't have a dynamic budget. We have an actual budget. So you cannot book savings in the future. But I'll let you in on a little secret. I'm also part of this group called the Poverty Reduction Task Force, where we're really taking a look at how you eliminate poverty in our state. We will, one day. And so a lot of the programming that we had done when we had robust budgets. And when COVID hit, we as a state, while it was challenging for everybody, the state was #1 in economic recovery after COVID. And when we looked at why, it was all of these programs that did early intervention, that were making sure that we had the safety net so that people weren't in crisis when we were giving them help. I'm talking about financial help, for work, for daycare, all of that across the spectrum. And so I could go into my caucus and say, aha, I am right. See, we have data to support it. And so that's some of the decision making we were doing during this budget year when they were looking at cutting programs. I was always saying, let's not cut the programs that will end up in people needing crisis care. Let's make sure we are saving those and making cuts in other places. So we had to make tough decisions, but that was absolutely the lens that I was looking at. And we just need more and more people talking about, what is the cost of not doing something instead simply of the cost of doing something. So thank you, Jerry.
Thank you, and we'll go to the question on this side.
Thank you, Senator Dhingra. Your commitment to this issue is so appreciated. Everyone here recognizes your leadership and is so grateful. I wanted to ask you about a bill that was in the legislature did not move fully around social media use and youth mental health. This bill is so important. We know from the Surgeon General that social media use is negatively impacting youth mental health. As we might expect, children's health advocates came out to support the bill, as did industry, which in the end slowed the progress of the bill moving through. I'm wondering what you see as key levers that children's health advocates can be supporting to move the needle on this important challenge.
Thank you. Oh, good, my daughter is in here. She's studying psychology at UW, and I told her to come by, but she has classes. She and I had this discussion all through middle school and high school. And, we have to do something in trying to regulate, educate our youth on the adverse impacts of their exposure to social media. And I have heard the positives as well. There are positives where people feel less lonely, they get access to services, but there are great concerns, especially with generative AI. We're hearing about these AI companions where kids or youth feel they have a friend online, but we're also hearing that they are really not doing a good job in navigating mental health. Someone may tell them they're feeling depressed. It's not predictive AI, it's generative AI. They may give them 5 best reasons, best ways to take your life. And so there are real issues with AI, but there's also issues with social media. One of the main reasons why that bill did not progress this year is because a lot of states that have similar bills are in litigation. And I'll tell you, everything this session came down to cost. If a bill was going to cost us a lot of money and wasn't essential, it was not going to pass. So that bill's going to be back next session. It needs more work, and I think there are many of us who are waiting to see how some of the court rulings in other states go down so that we can have a bill that's reflective of those court rulings. But this is where anyone who's in the tech industry, so many of you here are or know people who are, we need that partnership in making sure how we can ensure that the online community is also a safe community for our youth, because there are a lot of problems. The young developed mind, I don't know why I'm telling you this, you guys all know this, they're not able to process a lot of the information that is thrown at them. It's a wonder to me that not every single person under 18 is severely depressed at this point in time or has severe anxiety given what is thrown at them. But this is the future, and we're going to have to figure out how to navigate AI as well as social media and really have our children do that critical analysis on understanding what it is that they are viewing online.
Thank you, and we'll go to this side.
Thank you. My name is Michelle Makoto. I work for Downtown Emergency Service Center as a crisis outreach behavioral case manager. My question is, with already scarce resources for mental health, we're already scrambling, but we have other states sending their people to Washington. We have California and other states sending people to Washington. What measures are put in place for the mental health resources to be sufficient for everybody?
First of all, thank you, DESC, for all the work that you do. I will tell you, years ago, I didn't believe when I heard in the news that people were shipping mentally ill people to other states. And then as a prosecutor, we actually arrested people, and they're like, yeah, I was in a hospital in Nevada, and I was given an option of getting on a plane to Washington or being released to the streets. And so this person decided to come to Washington. And I was just horrified, right? Because what's the first thing we do? We try to connect people to community. We get them to have connections to people that they know. And this is what we're seeing. I'll even go back to say it's not even just the states. We actually heard of cities that would drive around in a white van, pick up the homeless people, and dump them in downtown Seattle. I know a couple of those cities. I had very strong words with their city council members and saying you can't just sweep your homeless people and put them in downtown Seattle. They still have connections. They still have people that they care and know about. I don't know what the solution to that is. Obviously, if mental health care was available to everyone, regardless of where they lived, and we didn't have NIMBYs, we wouldn't have this issue. But this is a reality, which is unfortunate, and thank you, DESC, is all I can say.
We have time for one last question, and we'll go with this gentleman over here.
Hello. Thank you, Senator, for coming by. My name's Joe Walker. I'm with the Recovery Navigator Program. Work with Pierre Washington. Oh, thank you. Shout out Pierre Washington as well.
And I'm sorry.
I'm coming up because, as many of you know, we work on the front lines. One of the barriers that we've come across is there seems to be a lack of state-funded detox centers that take state insurance in King County. We ourselves sometimes have to go to other counties. There's also a lack of that co-occurring factor as well. There's been plenty of times where we get a participant and unfortunately they have a dual diagnosis thing going on and the detox center is like, we're not equipped for this. And so now we got to scramble. My question is do you think, or is there potential legislation in the future to possibly increase the detox centers, at least in King County?
Thank you, B, for working with the Recovery Navigator Program. I know many of you know this. Unfortunately, we did cut funding for the Recovery Navigator Program. But we did have a bill that allowed for counties and cities to increase their taxing authority for law enforcement or criminal justice services, and in there I snuck in Recovery Navigator programs. So just so you know, if any city or county is planning on increasing their funding for criminal justice, Recovery Navigator program is part of that money. So please make sure you're going after that to do that, because it literally has the name right there in the bill. This is, again, something that Rep. Davis and I have tried to do a lot of work in, is trying to get away from the silos of substance use disorder, mental health, because it is the whole body. When I talk about head down to the toes, that's what I'm talking about. And it again comes down to, we need providers who are willing to do this work. I think Pioneer opened a new detox center in King County, I want to say. Please someone shout out yes if that's true. I think they recently did that. I see head nods. We would love to make sure that we have these centers in every single region. And I'll say this again, if someone is interested in opening one, let me know. We will make sure we try to figure out how we can get that open. A lot of this is not simply about money. It's a combination of making sure we have providers who are willing and able to do the work and have a location where they are able to do that work. And we want to make sure that we're doing this in partnership. I'll also tell you, this is not an issue that normally tends to be a Republican-Democrat issue. We have Senator Wagner in the Senate, who did not vote on the tax on 988, but is supportive of all other aspects of mental health. And he talks about how there was a substance use disorder, I think a recovery house that was opening up in his neighborhood. And at first, he had concerns. And then now he's like, they're some of the best neighbors he has. And so when people talk about, good neighbors and how you can have recovery homes and detox facilities and still be a good neighborhood, that is really helpful, right? Because at the end of the day, so much of this is about stigma and making sure that we're destigmatizing the perception that people have about people in recovery or wanting help. So I'll just say, we need partners who want to provide more detox facilities. We need them, and then we need the next level of what do you do after you have gone through detox. Thank you all so very much.
Thank you. Thank you, Senator Dhingra. And when we also talk about support, I'm going to ask all of you to support Senator Dhingra. Remember, she also needs your help too. So keep that in mind as we thank you for all of your information and insight into what is actually happening over there.